Well, if no amount of diet and exercise can shift that stubborn fat around your lower half, give yourself a break because you could be one of the 370 million women in the world suffering from lipedema. The good news is the condition, which affects more than 10% of Australian women, is totally treatable. Dr. David Amron is a world authority on body contouring and liposuction surgery, and he joins us now from his clinic in Beverly Hills. Doctor, it's great to see you.
Nice to meet you.
What exactly is lipedema and how is it different to obesity?
So lipedema is a definite fat storage disease and condition that presents in puberty. It's inherited from either the mother or father's side. It progressively gets worse throughout a person's lifetime, and it has a very characteristic look to it, which is very, actually not a difficult thing to diagnose, where the fat encircles the entire leg circumferentially from the groin area to the ankle area. The arms become involved, and sometimes there's a ledge on the upper buttock area. There's pain, swelling, easy bruisability that goes along with it, and it gets progressively worse.
So how do we treat it, doctor? And is surgery the only option?
Well, I think that to begin with, it's important to diagnose early. That's why there needs to be increased awareness. Other doctors need to learn about it, even pediatricians, OBGYNs, diagnosing in puberty or teenage years. And at that point, you can begin to do a lot of preventative things throughout a person's life before they're going to potentially need surgery. Dietary things can increase movement of fluid like gluten and stuff like that. And compression therapy. If people are swelling to wear compression garments before the need for surgery.
So what exactly causes lipedema, and can the fat actually come back?
Well, two good questions. The first question, we don't exactly know what causes it. It's what we call autosomal dominant. You inherit the gene from the mother or father's side. And it's a combination between not only the fat that's overgrowing and replicating in these areas, the legs, the arms, but the lymphatics are involved too with a leakiness. And what I think we're going to find is that lipedema is not only a fat disease, but a connective tissue disease too, where there's a lack of integrity. And you get inflammation in that layer of fat. You start to lay down scar tissue. We call it fibrosis, and you've got a vicious cycle going on.
You spend a lot of time treating patients who've had liposuction surgery and procedures that have been botched. What can go wrong and what are the consequences? I thought it was pretty invasive and can even, be risking your life if you wanted to go some of these procedures.
Well, it can be. Liposuction can be a dangerous procedure. It actually has one of the highest mortality rates. And I talk a lot about this, the importance of the proper approach. And one of the things I like to do, honestly, is to avoid general anesthesia. That's the biggest risk factor that goes along with liposuction surgery. So it tends to be much safer avoiding general anesthesia. That's one thing. I think another thing is the surgeon staying purely in that safe plane. That's not really talked about a lot, but if they're in there doing things, they're jabbing things they shouldn't be, that increases the risk of things. And lipedema, the disease we're talking about, has its own considerations.
You can get Coolsculpting quite cheap at various laser skin and therapy chains. Do you recommend those because they're being offered pretty cheaply to women and men, or can things go wrong with those?
Well, to begin with, this is dear to my heart, which is the proper evaluation of the patient. Coolsculpting is a procedure. It sounds great and it's non-surgical, and we offer it in my clinic here. But it's important that the person is evaluated properly and to be made sure they're a proper candidate. It's all about creating proper balance and proportion. And in certain people, they may qualify for Coolsculpting or another non-surgical procedure. But don't just quickly choose something because it seems like the easy, quick, inexpensive thing to do.
All right, Doctor, it's been great chatting with you this morning. Thank you so much for joining us and bringing us up to date on that.
My pleasure. Thank you for bringing awareness to lipedema.
Take care.